for me, the most important part of this structural immunity is the interaction between the structural cells in a tumor, in a solid tumor, and the immune system. Why? Because we have cures and we have methods to cure liquid tumors. Liquid tumors are, for example, leukemias, so are tumors of our blood. There we have a really efficient approaches. However, to treat solid tumors, we are using the same chemotherapy that 20 years ago. We don't have novel therapies that we can help the patients. So for me, understanding the crosstalk between the immune cells and the structural cells in a tumor is the most challenging and motivating aspect of structural immunity. So maybe I can first define what is T-cell immunotherapy against cancer. So this is a new field that is using the power of the immune cells, in this case T-cells is one kind of immune cells, to fight cancer. So what we have learned in the past is that the T-cells, in order to fight cancer, they need to have cell-cell contact. They need to be really close to the cancer cell in order to kill it. However, in the cancer, you have something that is called the extracellular matrix that is surrounding the cancer cells. And if this extracellular matrix is really complex, the T-cell cannot enter and cannot establish the contact with the cancer cell. What we have learned in the past is that this extracellular matrix is organized by structural cells. So only by understanding how structural cells organize the extracellular matrix, we can manipulate this and allow these cells to enter, find the cancer cells, and fight efficiently against them. I mean, what we have learned in the last 20 to 30 years is that cancer is not only one disease. There are many diseases with many causes and many consequences. So I don't think structural immunity is going to give us the cure for all cancers, but it's going to allow us to generate fundamental knowledge to understand which cancers can be targeted with which approach. And in this way, we can select better the patients that will benefit for the therapy. We will reduce the hospitalization times, we will reduce several rounds of therapy, and also the suffering of the patients. So the patient will get the best treatment as soon as possible without trying other not so efficient treatments before.